Tonight, I have the pleasure of straight away, of course, introducing you to the main speaker. That's what we are all here for. And the topic in question tonight is, diseases or problems or issues related to aging eyes. Okay, and here to share more with us is Mr. Zac Poo. So don't let his youthful looks fool you, yeah, because he's had 10 years of experience already. Actually, I've known him for at least, I think, 7 years, So Zac worked for a couple of very reputable optometrists before he set up his own practice. So he has a practice in the Hougang area. So those of us who live near here, very, very convenient. So without further ado, I'd like to turn the time over to Zac, who will also tell you a little bit more about himself. So over to you, Zac.
Thank you, Hiswan, for the introduction. So let me just share my slides. Right, so can everyone see the slides? Okay, thank you, Jeffrey. Okay, so thank you everyone for coming today. Thank you for using your Thursday evening and listening and learning more about eye care. So what I'll be going to go through today will be 5 common age-related eye problems, and also the prevention and the care of all these different eye diseases. They may affect you as well. So let me just go through the table of contents, which shows you what kind of eye diseases that I'll be going through today. So I'll first introduce myself, and then after that we'll be going through presbyopia, which is also known as Lao Hua. So I think most of you may have it or maybe in denial of it. So I'll go through more of it, and also some UV-related eye problems such as pterygium and preauricular, which is less commonly known. And I believe most of you will know what cataracts is, and probably want to learn more as well. Next one will be the more important eye diseases that all you guys should know, and also which is glaucoma, and it's also coined as the theft of sight. So why is it called a theft of sight? Later on I'll go through, and you better have to take note of some other things that to prevent this eye disease. Next up will be AMD, which is age-related macular degeneration, which is one of the leading cause of blindness for anyone who is above 50. So do take note of all these eye diseases as well. So let me introduce myself first. So I'm Zac. So I'm an optometrist, and I have a specialist diploma in community optometry, which specialize in mainly managing the common eye diseases that most people will have. So not all eye diseases have to be seen by the ophthalmologist, which is known as the eye doctor, because some of them can be managed by optometrists first. Before, let's say, any serious case, then you have to be referred. So then you can save the cost and also save the waiting time of when you're in the eye hospital. So what I specialize in is mainly pediatric eye care, myopia control, and also prevention of all these eye diseases. So before I go on, just let me go through a little bit of what I do. So many people may be confused of what an optometrist is and what an optician is. So most of you will go to the optical shop and not sure what to call them. So for optometrists, we are known as the primary eye caregiver. So what we study, we know about different eye diseases. We can check for children below the age of 8. We are able to prescribe glasses, and also we know how to prevent and manage some of the eye diseases. Unless it's severe enough, then we will refer to the ophthalmologist. For opticians, they mainly focus on just glasses. So they only prescribe glasses only. So this is the two difference. So I'm an optometrist, so therefore I will be going through the different eye diseases today. So without further ado, let me just go through the first eye disease of today. So the first one will be known as presbyopia. This is the name for Lao Hua. So if it's different from long-sightedness. The cause of it is different. So we will go through what's the cause of it. So I think most of you, if let's say you have Lao Hua, you will start to notice you have to elongate your arms and have to make your screen bigger to look at near things. So I believe that's a very common problem that if let's say once you reach 40, you will start to notice. So what's the cause of it? So for when we look at near objects, let's take a look at this eye over here. So when you look at near objects, the light rays actually produce the image right after the eye. So what is responsible to make the things clear is actually this lens over here right inside the eye. This lens is known as the crystalline lens. It can actually move. What moving means is that it can contract and also relax the eye muscle to allow you to see near. So when we look at far, the eye is actually relaxed. When we look at near, it's actually using the eye muscle to look at near. So what causes presbyopia is when the lens hardens as we age. So when it hardens, it loses the ability to make it clear for near, and also a weakening of your eye muscles right inside the eye. So when these two happens, it causes the light rays to reach to the back part of the eye again, not allowing you to see near. So as you age, you will slowly get worse and worse. And until when you reach the age of 60, that's where the maximum of the weakening goes. So that's why after 60, most of you will not have any increment of your presbyopia anymore. So usually the range of increment is from 40 years old all the way to 60 years old. Yeah. So what are the different signs or symptoms signs and symptoms that you may notice? So first is that your near vision starts to get blurry at the age of 40, and it will gradually worsen with age. So every increment of about 50 degrees, which takes about 3 to 5 years, you will start to notice you have to increase your reading distance further. Yeah, and if let's say you do not have any reading glasses or don't want to wear any glasses to make it clear, you will start to notice eye strains. You will have easily fatigued eyes, and also you will avoid any near tasks altogether. Yeah. One common symptoms of it will be headaches and also difficulty in changing focus. So what this means is after looking at your phone or your computer for long hours, when you look at distance, you may notice your distance starts to get blurry as well. So it may take time to clear up the vision. So this is because your eye muscles is constantly tense and it takes time to relax. So these are common eye symptoms of presbyopia. So it's best to wear reading glasses if you have presbyopia. If not, the prescription will go quicker. Okay. And the signs of it, if let's say you see anyone who is trying to make things clear, is by increasing distance, enlarging text, and also squinting, you can advise them to have their reading glasses done. Okay. So what are treatment options? So most of you may be confused about all of this. So first treatment option will be reading glasses, definitely. So reading glasses, what it means is a single pair of lens that allows you to see near. So they mainly focus on near only. So anything, when you wear the reading glasses to look at distance, it will be very blurry. So therefore, it's only for one distance. So therefore, people, when they find the hassle of putting in and on and off the reading glasses, they will opt for multifocal lens, which is known as progressives. So these two, the names are interchangeable. The reason they are called this is because for the lenses itself, they have multiple focal points. So what this means is when we prescribe the lens to you, we will make the distance portion of your prescription at the top, which is the widest field of view, and the near portion right at the bottom. So how this progression works is from the distance to the near, the lens design will be slowly progressing to your near portion reading. So because of this progression, the sides of the lenses will be a bit blurry. So it may not be suitable for everyone. So therefore, you may hear some friends saying that progressive are not suitable for them because the different lenses or different prescription may cause different dissociation on the sides. So they may appear to be like distorted. So some people may not like to wear it. Okay, so if let's say you do not want to wear any glasses at all, the next option will be multifocal contact lenses. So these contact lenses are specially made for you to see far and near by using what we call concentric rings. So at the design here, the center here will be for distance and the sides will be for near. However, for this type of contact lenses, if your vision expectation is very high, meaning you want distance to be perfectly sharp and near to be perfectly sharp, this contact lens may not be suitable for you because it's all together. You may notice a bit of distortion as well. So these are the options that you may consider if let's say you want to get presbyopia treated. So one common question that we usually see is that people will ask whether LASIK will help with presbyopia. So LASIK is possible. However, the prognosis may not be good because LASIK usually burns off the cornea. But for presbyopia, they have to burn it differently to let your cornea get thicker, which is the opposite of LASIK. So what this means is usually by 1 to 2 years, people who had done presbyopia LASIK before, they will start to notice things get a bit blurry still. So therefore, usually we will not recommend to do LASIK for presbyopia. Okay. Now, next up here will be another eye diseases, which is UV related. So this too is known as pterygium and pinguicular. So I'll tell you how they happen. So like the name suggests here is caused by UV rays. So let me go through what UV rays are first, because for UV rays, our eyes absorb them differently. So UV rays can be categorized to UVA, B, and C. So UVC is usually absorbed by our atmosphere, and UVA and B are the ones that are absorbed by our eyes. So for UVB will be absorbed by the front part of our eye up to our lenses, and for UVA will go penetrate through and reach our retina. And these two types of UV will cause different types of eye diseases. So how pterygium and pinguicula are formed are usually due to UV radiation or UV exposure. So these are the types of things that you may see for people who have these two eye diseases. So the first one is known as pterygium. So what they are is they are a fleshy triangular growth on the eye. Usually it attaches itself to the corneas, which is the one that helps you see. So your vision may be blocked, and it may also cause discomfort or pain if, let's say, the pterygium pulls on the cornea. The next up here will be the pinguicula. Okay, pinguicula is a growth on the white part of the eye, usually on the sides. So it can be on either side of your eye, the outer or the inner. So this may actually cause discomfort as well because it's growing and obstructing your eyelids when you are blinking. So what these two are is actually a degeneration of your fibrous tissue on the white part of your eye. And that causes it to have many different issues. Now, the one that is more severe is actually pterygium. The reason being because it's attached to your cornea, the clear part of the eye. So when you have pterygium, what you have to do, so there are different stages to it. So at first, you will start to notice your eyes are a bit red at the side, and they're usually constantly red, and you will see this fibrous tissue that's attached here. So it may not be very obvious to the naked eye unless it reaches moderate stage. So once you see people having this whitish part attached to the eye, you will have to best to have an eye check done and to see whether it's affecting the vision, because pulling on the cornea may cause vision changes as well. Now, in severe cases where the pterygium has reached the pupil, which is the black hole in our eye, and it causes some vision blockage, this one you will definitely have to do surgery. Yeah, so we will refer you to the eye doctor to have the surgery done. However, for this, once you have pterygium or pinguicula and you have done any surgery, is commonly it will be recurrent. That means even after the surgery is done, it may come back very quickly as well. So therefore, prevention is usually what we recommend, or right before when you even have the mild stage, because you don't have you better not to wait until the late stage. Now, what's the prevention of it? Now, for prevention, definitely it's just UV protection, which is the main component of preventing this eye disease. So for UV protection, the first one we recommend is definitely shelter. It's usually the best form of UV protection. So when you're under the shelter or in any form of shelter, usually you will not have any exposure to UV. Now, for sunglasses and lenses, this one you will have to take note because it's best for all of you to get UV 400 sunglasses or lenses. So what UV 400 means is 100% blocking of all the UV rays. Okay, so anything lesser usually allows some UV to pass through, which may not be very helpful. Now, caps, hats, and umbrellas, this one also acts as a form of temporary shelter from your eyes, so that would be good for UV protection as well. Now, usually does not require any surgery for pinguicula, okay, if the vision is not affected. However, do monitor on the shape, size, and color. If it changes color, it may be cancerous, so it's also best to have an eye check annually to track on the changes as well. Okay, now the third form of eye disease, which is cataracts. Now, cataracts is the one that most of you will say maybe sun more, or don't know whether you are whether you should go and see the eye doctor, or not sure whether you want to have the surgery done. So let me go through with you the different types of cataracts or when you should go and see the eye doctor. So what cataracts are, they are actually the opacification of the crystalline lens. So your lens will be very, very cloudy like this, okay? So it can be yellowish or even whitish. So it's a whitening or yellowing of the lens, and it will cause blurry vision. You will have sensitivity to light, and also you will see glares and halos. So all these are different types of signs and symptoms that you may see. So let's say we take a look at this. So it's a common scene. Let's say you're in a hawker center. For any head glares and halos, this will be your clear vision. If let's say you have stage 1, you will not notice much of an issue. Just light will start to get a bit more glary. So you will start to see letters being distorted, or you may see a bit of shadow in with small letters. At stage 2, things will get even worse. So this is the stage where you may consider getting eye surgery or getting the cataract surgery done. In the third and fourth stage, things will get very, very blurry. So by the fourth stage, usually you will not be able to see anything. And these vision changes are not correctable with any contact lenses or lenses. So therefore, usually surgery is the only option for you. Now, the reason for going through today is because some of you may not, you may know that you have cataracts and some of you may not want to go for the surgery. So this can be dangerous as well. So let me show you why. So for treatment and prevention, for UV protection will be definitely the prevention for any mild cataracts. So it's best to have the same, the one I went through before, sunglasses, shelter, and also hats and caps. So how mild cataracts look like? They will look like this. They are still, your lens are still a bit clear, but you do see a bit of cloudiness over here. Now, when you read the denser or mature cataracts, which means that you do hear people saying that the more it's in solar, or already mature. Yeah, so when you have this kind, your eyes will look a bit yellowish like this. So sometimes it can also be seen by the naked eye, but the moment when you can see your friend's eye being a bit whitish or yellowish, usually that's kind of a late stage. So the reason why it's dangerous to not do any surgery when it reaches late stage is because when the hardening of the lens happens, it will cause glaucoma as well. Because when it hardens, the doctor will have difficulty trying to remove the lens when they do the surgery. Yeah, so by second or third stage, usually is where it's the best to do the surgery because it's easier for the doctor to do. The risk of the surgery is much lesser as well. And for cataracts, I can say for most of you, if you're considering, it's a very safe surgery, so you don't have to be very worried about it. A very, very common surgery for doctors to do. Yeah. So what they do is they will shatter the lens inside, they will remove it, and they will put a man-made lens in. Yeah, and the benefit of this is they will give you your prescription when putting your man-made lens in, so you can see clearly without any glasses after. Yeah, so that's one good thing that came out of the surgery. Okay. So any questions, if you have this, you can always ask me as well. Now let's move on to a more dangerous eye disease now. So glaucoma, which is known as 青光眼, is also known as the theft of sight as well. So let me go through what glaucoma is first. Now, okay, so for normal eye, we do have liquids in our eye. So in these liquids here, they are known as aqueous. So for aqueous, they will flow in the eye and they will exit through the sides of our eye. These liquids here are actually is to regulate your nutrients inside the eye, providing them with vitamins and all the different types of minerals for them to work properly. And is drained from the side. This is a normal eye. Now, what happens in someone who has glaucoma? Okay, in glaucoma, the overproduction of the aqueous by our eyes or the blockage of the drainage will cause the eye pressure to increase inside. So imagine like a balloon with, and you are filling it with more and more water, it will start to press on the retina itself. So when you have high eye pressure, what happens next is this high eye pressure will press on the most fragile part of our eye right inside, which is your optic nerve. So when it damages the optic nerve, the first thing you will see is that you will start to lose your visual field, which is the side of your vision. So if let's say you notice your vision gets dimmer or when you notice things get darker, that's where you probably have to have your eyes checked because it may be glaucoma in your eyes as well. So what are the different symptoms, signs and symptoms? So the first symptoms here will be eye pain. You may notice eye pain, but eye pain is quite rare unless it's very, very severe. Dull and pulling sensation. So this one is the most common complaint. So you will start to notice there's this dull pain, a kind of a pulling headaches that's usually happening around the eye or near the eye. This is one of the symptoms that may occur. There's also a dimming of vision, meaning your vision gets darker. So you will start to notice your night vision may not be as good. Even in the day, you seem to have difficulty trying to look at things. These are one of the symptoms as well. In severe cases, this one is an emergency. If you have intense pain in your eye, you have extreme redness like this, and also nausea and vomiting. This one here is where your eyes, the drainage is totally closed. This is an emergency case. So if you have these symptoms, you have to go to the A&E immediately. Yeah, within a day or two, because you will lose your sight permanently if you do not get it treated. Yeah, so this is very important. This is like a eye stroke in the eye, but it's glaucoma. It's a glaucoma attack. Now, in severe cases, you will see redness and also haziness in the corneas as well. Now, why this disease is known as the theft of sight is because sometimes you will have no symptoms at all as well. So you will not notice anything. You may go around your day normally, but suddenly you will start to lose your vision at the side. without noticing anything. So this disease is usually due to genetics as well. So it will affect female more. So if your mother is have glaucoma or your aunts have glaucoma, best to have it checked as well. Now, what will you see is like this. So you will start to notice your visual field at the side get dimmer, and you will be only left with your central vision. So in the late stage, you will be only left with a tunnel vision. Therefore, it's very important to get your eyes checked yearly, okay, for anyone who is above 50. Now, for glaucoma, what are the treatment options? So the treatment options first up will be your eye drops, medicated eye drops by the eye doctor. These eye drops here are aimed to lower your eye pressure. So it's best for anyone who is prescribed, it's important that you follow it strictly according to the dosage. Now, what happens when this doesn't work? The next one will be, they will give you steroid eye drops. And if steroid eye drops doesn't work, it's oral medication. And the later stage will be surgery. Yeah. So surgery, they will open up the drainage area. Okay, it's a very big surgery because they have to remove all the sides of the eye to allow the liquid to flow. Now, for people who have any risk of glaucoma, there's actually a prevention that you can do. So this is actually known as something like punching a hole on the sides of your eye. Okay, it's known as peripheral iridotomy. So what the doctor will do, they will laser the top part of your eye, this small little hole, to allow the aqueous to flow. Okay, so like it's opening a wider drainage for your eyes to have the aqueous flowing. So this is preventive surgery. Okay, it's a very quick surgery for the doctor to do, and it's for to prevent the glaucoma attack altogether. Okay, so this is one of the prevention that you can opt for as well. But it depends on what kind of glaucoma you may have or the risk that you may have. So this one you have to have it checked first, of course. And the last one here will be known as your age-related macular degeneration. So previously for glaucoma, it affects your sight vision. Now for AMD, it affects your central vision. So if you have both, you will lose your sight totally. So for AMD here, the symptoms here is actually distortion. So this will be usually the first one that you may notice. Okay, distortion meaning that when you look at straight lines, you may notice some lines are a bit wavy and some things may not be appearing like how it should look like. So you will have overall blurriness and a darkening in the center. That means your vision at the center, suddenly you will notice this black dot inside there. It follows around your eye as well because this one is affecting retina. And you may lose your color vision as well. So therefore, for macular degeneration, we will also check on your color vision. So if you notice your colors on both eyes are not equal, you may have AMD as well. Okay, so if you notice the color is not as vibrant when you compare, then it's best to have your retinas checked. So what are the risk factors? Now, the first risk factor is definitely smoking. So if you smoke, it's best to totally stop smoking. Age is definitely one of them. So for age, the risk factor increased significantly after age 50. So now for this one here, if you have one eye that is affected, that means if one eye has AMD already or diagnosed with AMD, there's a 50% chance that in the next 5 years, you will have the other eye affected as well. So usually tied in together. Now, genetic is also one of the factors, and also there are 3 factors. So there are 3 factors is usually linked to your systemic conditions. So if you have high cholesterol, this may also cause the risk of AMD to be higher. Okay. So the changes in the eye. So if you have AMD, how your retinas will look like, it will look like this. So why does AMD happen is because the eye loses its ability to remove the deposits. So in the early stage of AMD, you will notice this kind of yellow dots over here. So these are actually known as drusen. They are like deposits in the eye that the blood vessels are unable to get rid of. Once you have this, it will progress to a later stage. If it's uncontrolled, it will start to affect the layers of the retina, causing vision losses. So the moment you notice vision losses, the AMD is already happening. Okay, so it's best to have it checked also. Now, once it reaches this kind of bleeding stage, you will start to lose your vision totally, and you have to have the treatment done as soon as possible. So what kind of treatment is done? So if you have heard of people injecting the eye, that's actually one of the treatment of AMD. So the treatment option is actually injection to the eye. This injection is aimed to stop the blood vessels from growing and thus stop the bleeding in the eye totally. So if let's say the bleeding still continues to happen, laser therapy can be done. So this laser therapy is to stop where the bleeding occurs So it burns a scar so that the blood vessels is closed. Okay. And visual aids. So if by the time if it's late stage AMD, most of the things you are not able to see. So you may need magnifiers or different kind of lenses to help you see. So you may have a very specially made lenses just to help you see with that little small portion of vision that you may have left. Now, what is the prevention of AMD then? First up is definitely to stop smoking. Healthier choices like diet control and also exercises may help, and vitamins to slow down the progression. So for vitamin as a prevention, there's a very extensive study that's done in America. Okay, this study is known as the AIRETS-2. The long term will be age-related eye disease study. So this study has been ongoing for many years, and what they found is this list of vitamins that are listed here is shown to slow down the progression of AMD by 25%. However, for vitamins, what is usually recommended is that once you have it, you have to have it constantly to have the effect, because it's a long-term consumption that helps. So for this one here is one of the prevention for AMD. So let me end this talk off with one of the quote here. An ounce of prevention is worth a pound of cure. So whatever prevention that you can do is definitely worth preventing from all of these eye diseases. And because your sight is one of your senses, it's also more important to take care of them. So yeah, like what Huishan mentioned, I do have my own practice at Hougang. Okay, it's known as Royal Light. So right now, for all of you joining this talk today, we will be giving you a special rate of $68 for all of these eye tests included. So all these eye tests will be able to check on your eye health, your vision, as well as your eye functions. So it's basically the whole eye check to make sure that you can see well, and also all your visual functions are working in normal conditions as well. So for this year, I would like to thank all of you for the time. So yeah, so I'm a Royal Light Optometrist. Anything, you can always contact me over here for any questions. So now I'll pass on to Huishan. Yeah, and I will introduce the next speaker.
Okay, thank you so much, Zac. Thank you, and for keeping to the time. And in this short time, giving us so much information. So this slide is left on. If you want to see Zac or contact him, please take a photo of this slide. I've gone for that very comprehensive eye test myself, brought my parents as well. So it is not your usual just check your degree kind of eye check. So a very good I would say a very good eye checkup is a fraction of what you would have to pay if you straight away go to the eye specialist. Okay, so Zac has given us some preventive measures, and so I thought it might be a very good and very appropriate for me to call on the next speaker to tell us specifically what sorts of supplements can we take to help our eye health. And here to bring this next segment, which will only be 10 minutes long, is my good friend, Mr. Jeffrey Sang. So Jeff actually has a degree in business administration, and he went on to actually become a journalist with the Business Times, and became also a public affairs head, of MNC. Eventually, he had his own firm, his own multiple businesses, and he had the good fortune of retiring early. And he spends a lot of his time now keeping in good health, studying about health, and sharing with people how they too can get good health. So I'd like to hand the time over to Jeff.
Thank you, Huishan. Yeah, I love it. This health is so important. So 10 minutes as we promised. Thanks, Zac, for what you've said, because I like that you mentioned AIRETS, right? Which is age-related eye disease study. And then it was followed up by a AIRETS-2. Okay. And this first product that I want to show you, called Eye Formula, was created so that it's in accordance with AIRETS-2. Okay, all the recommendations of AIRETS-2. Just FYI, under AIRETS, they studied these people with their eye health using supplements for an average of 6.3 years. So it's a very extensive study. And that's how eventually they came up with ailments 2 and eye formula was created in line with this. Okay, so I won't talk more about eye formula. I'll leave the scientist who was behind the development of eye formula to tell you.
Hi, I'm Dr. Shelley Hester, a senior scientist on the Global Pharmanex product research team. Today, I'll share how a modern lifestyle contributes to eye strain and how Pharmanex's eye formula can help care for your eyes. Our eyes start working from the moment we wake up in the morning to the time we sleep at night. Not only that, our environment and lifestyle have digitalized over the years, and more than ever now, we demand that our eyes work tirelessly, facing digital screens all the time. The central part of our retina, called the macula, is particularly susceptible to free radical damage. But that's the part of our eyes responsible for the central, high-resolution color vision we rely on. Luckily, our bodies have a built-in solution to these problems. It just requires some specific nutrients, 2 carotenoids called lutein and zeaxanthin. You need these carotenoids, but your eyes cannot naturally produce them. Meet Pharmanex Eye Formula. It's powered by lutein and zeaxanthin. In fact, Eye Formula provides a clinically effective dose of 10 milligrams of lutein and 2 milligrams of zeaxanthin to help protect the eyes from the harmful effects of visible light. You might be wondering, if you can get lutein and zeaxanthin in your natural foods, the answer is yes, but it may not be enough. 2 capsules of Eye Formula provide 12 milligrams of lutein and zeaxanthin. To get an equivalent amount from your diet, you would need to eat 8 cups of corn, or 6 cups of broccoli, or 4 cups of raw spinach every day. Finally, Eye Formula also provides a blend of complementary nutrients for eye health, including vitamin C, vitamin E, zinc, copper, and selenium. This proves to be a more comprehensive solution based on the latest research. You will love Eye Formula because it helps reduce symptoms of eye strain and eye fatigue, helps support macular pigment layer that helps filter incoming light into the eye, helps provide support and key nutrients important for eye health and function, helps protect cells against oxidative damage, and provides nutrients that help to reduce glare sensitivity and improve contrast sensitivity. Most of the studies done on the ingredients in this formulation are at least 2 months long, so it does take a while for the benefits to build up. We recommend taking it regularly for at least 1 to 2 months to really start seeing some of these improvements. Eye Formula is easy for you to integrate into your lifestyle. Simply take 2 capsules once daily with food. Lutein and zeaxanthin are carotenoids and fat soluble, so taking it with food that has fat in it will help to improve the absorption. Eye Formula is great for adults who are exposed to harmful levels of visible light or who just want to support eye health. Let me share some great complementary products you can take with Eye Formula. ageLOC Wispan and Marine Omega provide EPA and DHA, 2 omega-3 fatty acids that have been studied for eye health benefits, especially in protecting the macula. In fact, DHA is present in higher concentrations in the retina than any other tissue in the body. Another great complementary product is LifePak. Besides a targeted solution for the eyes, it is also important to have a nutritional foundation consisting of essential vitamins, minerals, and antioxidants for general wellness.
So I just want to have a few more slides. I'd like to show you this. This is about Wispan, which you heard her talk about. And this is also our anti-aging formula. It does have marine omega, which you omega-3, DHA and EHA. And as she was saying, it's really good for eye health. And you know, just earlier I was talking to Zac, and Zac was saying that marine omega or omega-3 is really good, especially when you have dry eyes, when you suffer from dry eyes. Okay, and of course, that was marine omega you see there on the left, and LifePak. What is LifePak? LifePak is our foundation nutrition. Okay, because you know, it's not just about taking eye formulas. You want overall health, right? And remember what she said, it does take time for it to build up. So as all the body systems work better, your eyes will also improve. So a life pack is there. But besides this, we wanted to recommend to you also the one on the right, which is G3. G3 is a superfruit juice. It's made of the gag fruit, you see there, top left, okay? And as well as silly fruit, lycium, Chinese lycium, and Siberian pineapple. So we've found that you can use this if you don't like to take more pills, you can drink this, okay? About 30 to 60 milliliters in the morning and then again in the evening. It's a nice fruit juice and it's really very good for eyes, okay? So that's the supplements wanted to tell you about. But the question you may ask is, but I'm already taking supplements. Do I need more supplements? And do I have enough or do I need more? Well, the wonderful thing is you can know definitively. You can know exactly, okay? And how do we do it? We have technology to check out without being invasive. We can check out what is the level of antioxidants in your body, okay? And this is done through what we call a biophotonic scanner. And so it's put on your skin and then we check it out. And so you can see that it will give you a reading. As these three people have their own readings, it will give you a reading and you will know what is the level of antioxidants in your blood. Okay, so we have a total solution for you here. All right, so thank you very much. I'd like to hand this back to Wiswan.
Wow. Okay, thank you, Jeff. Thank you for that very quick summary of the things that will help us with our eye health. So, well, it just leaves me now to just remind everybody, if you'd like to have your eyes thoroughly checked, please go and contact Zac. If you want to know what your antioxidant level is like, then contact the friend who invited you to this talk, or you can also contact Zac if you're Zac's client, and we will make sure that you know where to go, and then you can get your antioxidant scan for free. Okay, so thank you, everyone. Thank you very, very
One
much.
last thing, Wiswan, if you don't mind. You know, the G3, we do
Oh,
have a
yeah,
very
right.
special offer for the G3 right now. There's a 10% discount. Okay, so also for that, do go to the person who invited you. This promo is only until the 29th. Okay, it's only until the 29th.
Yes. Okay, thank you so much. Thank you, everybody. Thank you and good night.